thank you all for coming out tonight firstly. I know it's not very nice outside and it's cold and it's dark, so thank you for making the effort to come this evening. Really appreciate it. I'm looking forward to sharing with you tonight a little bit about traditional Chinese medicine and acupuncture and how it can help those of you that are transitioning through the menopause or maybe have some other health and well-being conditions that would benefit from looking at acupuncture, certainly. So I know tonight's talk is focused a little bit about menopause, so I'm looking forward to sharing that with you. For those of you that don't know me, I'm Deanna and I've come from Middlesbrough this evening. I've come to talk to you all about Chinese medicine and acupuncture. So I'm not just somebody who's passionate about it, I'm somebody who's really highly trained in it as well. I have a lovely wellbeing clinic in Acklam inside an old doctor's GP surgery, and I work with a lot of women and also men too, that are suffering from various ailments, whether that be a physical condition or an emotional condition. And I help people feel better, and I feel really grateful and privileged to be able to do that. But part of my work is in being an acupuncturist and helping people find balance and healing through traditional Chinese medicine, through needles essentially. Now, most people, when we think of needles and we think of acupuncture, that thought is kind of off-putting, because for some people that might conjure an image of somebody looking like Hellraiser with hundreds of needles in their head, or looking like a hedgehog. And I know that when I've been travelling various places, I've once seen a poster on a billboard of somebody covered from head to foot in needles, and that's just not the reality of traditional Chinese medicine and acupuncture. It is a wonderful, safe and holistic form of medicine, and it's existed for thousands of years. And also, in this day and age, we're all those of us that are acupuncturists to the degree standard are all highly trained in anatomy and physiology and understanding what we're doing when we're placing needles into you. We're not just putting them in your body for the sake of it. We're specifically targeting acupressure points on the body where energy flows. So it's a wonderful form of medicine. So this is my clinic. I'm based in Acklam, and I work through the week, and I help people who have got maybe musculoskeletal conditions or a mental health problem. But I do work with a lot of women for infertility, for menopausal symptoms, for a whole host of things really, because I do feel sorry a little bit for women, because we get the brunt of it, don't we, with our hormones and whatnot. So I have a Bachelor of Science degree in Chinese medicine and acupuncture. I studied at the Northern College in York for 3 years, but I'm also passionate about other types of acupuncture and other systems of it as well, particularly auricular, because what's wonderful about it is we can treat the body through all different ways, through feet with reflexology. You might be familiar with that previously, through the hands, through the ears. It's just amazing. So I've been in practice for about 18 months, and I just love the results of what I practice and how it's able to help people. So passionate about that and keen to share that with you this evening. So if we talk about menopause, and I'm sure you've had lots of different people from different backgrounds come and talk to you about some of the symptoms, and many of you might have experienced it yourselves too. I came into training to be an acupuncturist because I wanted to learn more about alternative medicine, and I absolutely adored reflexology and how it was able to rebalance the body, and it got me curious how there's a little bit more than just what we see on the surface. There's a little bit more than just looking at our limbs and thinking, do you know what, I've got a pain here, but why have I got a pain here, and how come it aches if I touch it? And acupuncture helped me explore that and learn a little bit more. In terms of menopause, there's lots of different symptoms. There's over 53 symptoms that are associated with us as we transition through, that some of you might be familiar with, you might have experienced, or you might know somebody who's suffering from them. But there's not a lot of support out there, is there? And, I constantly hear in the background about the NHS being clogged up or not having enough funding or resources. So I think people who are able to come and offer some advice and support, it's it's very welcome, and it's wonderful that they're able to do that. And what you're doing here this evening, coming together, it's absolutely fabulous, because not only are you supporting one another, but you're bringing in different speakers who can help shine a light and a little bit of education around it too. So in the UK, obviously we've got lots of different ways of categorising menopause, but typically, on average, the average age for transitioning through that menopause or getting a diagnosis is 51. But for a lot of people that I work with and see in my clinic, they're a lot younger than that. So it can vary, because we've got different phases and different stages of the menopause, and we can be perimenopausal leading up to that menopause phase, where we're suffering with the symptoms in that space too. And that can happen 10 years before. So really, when you think about it, 51 is where we get the average, that's the average age of UK women. But in other countries, it varies. Some women are older, some are younger. So 3 stages: perimenopausal, menopausal, postmenopausal. And I often work with a lot of ladies who are perimenopausal too, because they're starting to feel the severity of some of those symptoms that are associated with menopause, and those hormonal changes too. So obviously it's a natural part of life that we all go through, but for some, it can be worse for some people than it can be for others, and there's no right or wrong. And the wonderful, beautiful thing about that is that we're all different, we're all individual, we're all unique, and it's not the same for you and I, is it? So that's one thing I love about Chinese medicine, and how it's very holistic in its senses that it treats you as a person, as an individual. It doesn't just treat you as, oh, you're a menopausal lady or you're perimenopausal. It doesn't work like that, because how we feel and how we think affects what's happening to us and what we're going through, doesn't it? So I really like that. And I love as well that it looks at life through a different lens, through an alternative lens, that for thousands of years they've known all these different ways of balancing and healing the body. It's very, very clever. Although it's a natural process that we go through, the Chinese look at it as though we go through 7-year cycles. So we transition through different phases in our lives as women, which makes sense really if you think about the age that we start our periods, to the age that we start having children, to when we transition through the menopause. And as we get older, obviously things start to decline, don't they? So there's a 7-year cycle in Chinese medicine. The other thing is, 51 is an average. It doesn't say that that's a definite age that you're going to transition through it. For some, they might be younger. For some, they might be older. There is also a train of thought that you might follow. There's a tendency that we can follow our parents, our mothers, in terms of what their menopause was like and what age they went through. I'm a bit hit and miss about that, to be honest, because obviously there's no evidence that backs that up. And it just tends to go by what a lot of people experience and what they've found out that their family members have experienced. But it is a natural part of life. So, and anything that we can do to support that and help that, I think, is a really positive thing, because for some people it can be almost life-destroying, can't it? And I know there's been a lot of light lately on, menopause being in the news and the press and different celebrities talking about it. But I think it's a big topic that really could do with a lot more research and a lot more support given to it, because it's something that affects all of us, particularly women. But I also know now as well that, there's a lot to talk about it affecting men as well. So it's quite fascinating when you look into it. So 34 symptoms of menopause. There is a lot more than that, but that's typically what is classified as the main things that people suffer with. So obviously the changes in the hormones can expose us to needing to put more weight on, to having a low mood, to not even sleeping well. Also, health issues, musculoskeletal, with osteoporosis and all sorts of other things. The biggest thing I probably see in my clinic through menopausal symptoms is low mood, sleep, hot sweats, anxiety, pain, thinning of hair is quite a common one, and also loss of libido too. But there's no set criteria as to what you will experience or what you won't experience, because it's different. And I guess a lot of it also has to play with how well you look after yourself, because what you eat affects how you function and feel. How much rest, how well you rest, whether you overwork or you push yourself too hard, whether you exercise exercise too much. All these different factors affect how we handle things in life, don't they? So yeah, so those are a lot of the symptoms, but there is a lot more out there, and typically, you know, there's quite a few of those that are categorised as the main ones, particularly with like the hot flashes and the night sweats. So traditional acupuncture, let's have a look at it, and how I've put it as menopause acupuncture because tonight that's what my talk is really focused about. But really, it's a branch of Chinese medicine, and it treats a person, it treats you as a person. So it looks at all these signs and symptoms, and as an acupuncturist, when I work with a patient, I basically put together a points prescription and some lifestyle advice and some support to be able to help treat that person. What I like about it is it treats the root of the problem. So a very thin, fine stainless steel needle is inserted into an acupuncture point, and there's hundreds on the body, existing on energy lines called meridians, where energy flows through the body. So it's said that when a blockage occurs or an imbalance occurs, this can manifest as either as a physical ailment or a problem or a pain. So by putting a very fine needle in, we can treat it, and we can restore balance in the body. It's used worldwide, and I love that. So obviously the ancient Chinese have known for thousands of years that this wonderful form of medicine can help people. How they knew where acupuncture points is just incredible when you look back at the ancient texts, and what they know and how science can back that up these days is just incredible. One of the things I love about it is quite a lot of people are new to the concept of acupuncture, or might be unfamiliar with it and maybe think, oh, well, I'm not sure it's going to work for me. Does it work? Is it placebo? Who knows? What I can tell you is that there's lots of emerging science coming, you know, research that's coming available, particularly on websites like PubMed, and in journals of Chinese medicine and things, where they're able to show from clinical trials how effective acupuncture is at helping certain conditions and certain ailments. So there's a lot of conditions that acupuncture is well known to help with, whereas there's not so much research done. So the NICE guidelines have recommended acupuncture for the treatment of and management of chronic pain, which is great because it means it's able to be used as a natural alternative to taking loads of pain medication. So it's just, you know, it's an alternative option for a lot of people. So obviously you can see the image here of this gentleman, this lovely mummy or dummy or whatever we want to call him, or model, and you can see these red areas represent the lines and the flow of energy, the meridians, and the various little numbers that you can see are all like the acupuncture points that are on the body, and there is hundreds. So it's really good for helping with a certain array of conditions, from headaches to migraines to infertility, sleep quality, your digestion, a lot of symptoms that you would also be experiencing if you were transitioning through the menopause too. Okay, so in Chinese medicine, menopause is a phase that all women go through, but it's a phase that we call the second spring. And I like that analogy, you know, because I see a lot of people who are kind of transitioning through perimenopause or menopause, and they're making changes in their life. They're actually, you know, readjusting things, and quite a lot of them are maybe changing jobs or going through divorces, or, you know, looking after themselves or focusing on their health and well-being. And I think for a lot of women, it's about finding meaning and purpose in your life at that point, because it's like a big important change in your life, isn't it? And I like that Chinese medicine doesn't separate the mind and body, so it looks at where you are on your journey and cultivates a plan to support you, taking into consideration your physical health, your well-being, your mental and emotional, but also your spiritual well-being too. So often it's a starter of a journey for us women where we're no longer able to have children. It's a change of hormones within our body. And for some women, you know, that can be a sad space if they've not had a chance to have children, or they're not wanting to, or they're not ready to transition into that space. So some people I see in my clinic are perhaps, you know, going through a little bit of sadness associated to grief, because they're not kind of ready to go through that journey. But, you know, Mother Nature calls at a time that we all can't really guess or plan, and we've just got to kind of look after ourselves as we transition through it. It's kind of classed as quite a big transition in a woman's life, whether that be causing emotional impact, spiritual impact, or physical impact too. So in Chinese medicine, we know that when we as women, when we transition through the menopause, one of the factors is that it's a change in our kidney energy. You know, we have a natural energy in our body that's connected to all our organs, and one of them is the kidneys. And like I said to you earlier, we transition as women, we transition through 7-year cycles. And there's a good example of this here, and being around the onset of our periods, being around the age 14, which is 2 times 7. And also, you know, how when we're going through the menopause, the average age, you know, is 51, but then also our body kind of needs to look after, it needs that a little bit more nourishment, it needs a little bit more time to conserve our energy in our blood as we look after ourselves. But actually, it's also a part where our body naturally slows down the aging process, which is a bit ironic, isn't it? Because, you know, we're getting older, we can't really pause time. So we go through different phases as women. Our hormones certainly do as well, lots of different changes, and obviously they impact us in so many different ways, but the biggest being our reproductive health, isn't it, really? So yeah, that's menopause. So let me share with you some of the treatment options in the UK. You'll be familiar with this. So the main one is HRT, which is really, you know, I know there were shortages earlier on, wasn't there? Was it last year? There was quite a few shortages, and there was a lot of panic over people being able to get the medication that they needed. And there's no right or wrong with HRT, because it's about finding what works for you, what pathway that you feel most comfortable on and get relief from. But some of the research that's emerging from some of, you know, the people that I follow and you know, take advice from, show that HRT is not always the best option to go down, because obviously it influences hormones and it comes with associated health risks. However, when we compare HRT and its clinical results and some of maybe the symptoms that the medication can cause or the effects, and we compare it to acupuncture, acupuncture's got a proven track record of being a really safe way in modern medicine of helping to alleviate some of those symptoms that you might be suffering with in menopause. And it's very much demonstrated that in my clinic when I've been working with patients and helping them. I know that a lot of my patients report to me after coming to see me for treatment how much better they feel in their mood, in their sleep, in their digestion, because everything plays a part in how you function and feel. So yeah, so I wanted to highlight this. So this is why I was talking about the ears when I arrived. So I bought this lovely poster with me from my clinic in case you wanted to look at it up close in person. And it's part of the NADA protocol for ears. So it's part of a treatment process, and it's based on the fact that everywhere on the body is a mirror to each other. So your feet can be treated and balance your body, your hands, your ears, all sorts. But what I like about it is the ears act as a switchboard. And what fascinates me is, can you see that little picture there of the fetus? And so the idea is that the fetus mirrors the body. So by treating the ear, we treat the body. But I do know that also the ear is pretty much a switchboard to the brain and to its function. So we can use acupuncture to really help balance the body through placing them in acupressure points on the ears. It's really powerful and it's really effective. So it's called the NADA protocol. But there is other names out there that are also mirroring the similar technique. But what I will say about it is the research, that the clinical trials that they're doing and the research that they're publishing on it is amazing, because I know that my good colleagues over at James Cook Hospital use this protocol to help patients who've been through breast cancer and are suffering with those hormonal changes from all the medication, from the radiotherapy and chemotherapy. I also know that it's very effective for treating menopausal symptoms, particularly hot flushes. And one of the recent trials, one of the recent publications that they put out there was to show that it reduced it by 44% for hot flushes after a series of 8 treatments. So I just think that that's phenomenal, because, you know, this is a natural alternative medicine that doesn't involve you taking any nasty side effects, and it can support your overall wellness. So as you can see here, we've got 5 different organs, so 5 different acupressure points that are associated with what is going to get, where gets needled essentially. So the first, you know, there's a sympathetic, there's Shenmen, there's the kidney, there's the liver and the lung. So it can balance the whole body, bringing it into homeostasis. And what I find so fascinating about it is just that it's very effective. I also know that the prisons use it to help with their prisoners who are suffering with low mental health. I also know that the drug and alcohol services use it to help people who are having withdrawal symptoms from alcohol and being intoxicated with other various substances. I also know that people use it across different mental health. There's been lots of studies done on people. Do you remember when the Grenfell Tower went up in flames and burnt down, and a lot of people were very sadly affected by that? There was a project that was put together that was treating people for low mental health and helping them to overcome the challenges that they face of trying to rebuild their lives. This supported them through it, and it's just incredible to think that 5 tiny needles in your ear can rebalance so many things in your body, and it's actually a really, really relaxing treatment. We think of needles and we think of pain, don't we? I totally get it, you know, but what I will say to you is they're nothing like what the needles are in the GP surgery. So, you know, a needle that would do an injection has a bigger needle gauge, whereas an acupuncture needle or an auricular needle has a really thin, it's really thin, so it's thinner than your hair. For most people, they don't feel it. Ears, however, can be a little bit, they're hard skin out, so they can be a little bit tender, but most people don't feel it, and for the majority of patients it's really relaxing, and it's a little bit of what I like about it. It offers you a little bit of a space so that you can connect with yourself and take that time for you, because as women we're guilty of putting everybody else first on the to-do list and putting ourselves last. We don't take enough care of ourselves, you know, and this is a wonderful way that you can relax and also rebalance too. So I've put a lovely link here if you wanted to look up that study yourself, because, you know, it's evidence-based medicine. It's now becoming so popular that hospitals are taking on board actually something nice and alternative and natural can help people and can work alongside Western medicine in the hospitals. You know, I'm hearing of thoracic surgeons also using this on their patients. And in China, I'm led to believe, I've never been to China, but I'm led to believe by other colleagues that in China they use acupuncture in their hospitals alongside their doctors to help their patients. I mean, that's just incredible, isn't it? To think a 2,000-year-old form of medicine has travelled that way and is still very valuable and useful today. It's just phenomenal. So there is slightly different. So ear acupuncture is the nada, and then I also practice, because I'm a qualified acupuncturist, I practice body acupuncture. So again, this is putting needles into various acupuncture points on the body. Can be on your legs, your hands, your arms, your feet, and also the research is emerging on there as well. So what it shows is that, you know, menopausal women, when we're going through the menopause, I mean even perimenopausal, even, you know, lots of different people suffer with hormonal imbalances that cause maybe a low mood, can cause a depression and anxiety, and can also, you know, be pain, hot sweats, insomnia, all the symptoms that we looked at earlier. Body acupuncture can also help as well. So quite commonly I'll put a couple of needles in the hands and the feet, but there'll be acupuncture points that are chosen specifically to help with the symptoms, to offer some natural relief. So what's really nice is that the emerging research is showing that acupuncture can help with not just those symptoms, but also musculoskeletal conditions like osteoporosis or bone conditions. It offers a nice alternative way as to placing you on more medication, and you know, it's really good to optimize the flow of energy in the body. And sometimes you can feel a sensation, so you might feel like a sensation of moving along your arm, or you might feel like a dull ache or a sense of peace and relaxation. So it's really, really good. Again, I put another lovely link here. So the evidence-based acupuncture community are doing loads of wonderful research on helping to shine a light on how body acupuncture can help reduce some of the symptoms that come with going through that transition. So as an acupuncturist, I work with people. I've been in clinic for 18 months and I'm based in Acklam, and I offer, you know, daytime, evening and weekend appointments. I sound like a workaholic, don't I? But I'm not. Here's what some of my patients have said, you know, feedback of. These are real reviews taken from my booking system with their permission to share. So when I work with a patient and I you know, look at what it is that they're coming to see me for and how it's affecting them, we create a treatment plan. And for some people that might be 6 weeks, for some people that might be once a month, for some people it might just be the one session. It varies. What I often find as well is that I see women who are transitioning through the menopause with a lot of shoulder issues as well because of the change of hormones in the body. So shoulders is something that I can also help give some relief for. So these are some of the lovely reviews. So it's just nice. It's wonderful to be able to make a difference, and it gives me a real sense of pride in my job when I see somebody on their first appointment and they're in a very dark, low space, and they're telling me that they can't take any more, and that their mood is so bad that everybody that they live with is affected by it, and their job's affected by it. They just want to give up. I mean, that's a very low space that and I feel it from them. When we get to the end of the session and they're like a completely different person, you know, through a 6-week treatment plan, it's incredible. And it makes me so humble to think that acupuncture can help support that journey of recovery, of healing, of self-care, of taking that precious time for ourselves from overwhelm and burnout. I've also got a lovely free ebook that I've wrote about mastering the menopause. So this is full of nutritional advice. So obviously nutrition is one element of transitioning through the menopause. What we eat affects how we function and feel, and there's some things that you can incorporate into your diet to support you, so like a good multivitamin. You know, also in this book we talk about having a more alkaline based diet to support your wellness too. So that's freely available. If you wanted to have a read of it, give me your email address, I can send it out to you. But it just shows some of the research backed ways of things that you can do to help support your journey too. That's it really. I'm at the end of my talk. I hope you've enjoyed it, and I hope you've learned something new. And if anything, if you've got any questions, please feel welcome to come and ask. It's such a big topic. When I arrived, and they were like, "You can talk for an hour and a half." I was like, "I haven't got that in me." But an hour and a half, I think we'd fall asleep at some point if I went into the science and into the research. But just really to give you a little bit of a snippet and an overview of how acupuncture can help, and it can help you in whatever phase you're in, or lots of different things. So come and have a chat. All right.
If you send that